This is a CJASN podcast, and I am George Schwartz from the University of Rochester. The NIH-funded Chronic Kidney Disease in Children study, or CKD, is an observational cohort study of children with chronic kidney disease. CKD has been one of the most successful studies involving pediatric nephrologists, epidemiologists, and psychologists in the United States and Canada. With over 50 sites recruiting participants, we have examined the progression of kidney disease in nearly 900 children thus far. Several of our studies have shown that proteinuria is one of the strongest predictors of progression of kidney disease, whereas proteinuria, or more specifically urine protein creatinine ratio, is routinely measured in children to assess kidney impairment. In adults, urine albumin creatinine ratio is used more widely. Our study was designed to compare associations of urine protein creatinine ratio and urine albumin creatinine ratio with both baseline kidney function and progression of kidney disease in children with non-diabetic chronic kidney disease. We first performed a cross-sectional analysis to assess the association of both proteinuria and albuminuria with estimated GFR. Urine protein creatinine ratio and albumin creatinine ratio were very highly correlated with each other over the full range of urinary excretion, with a correlation coefficient of 0.92. GFR was 16 ml per minute lower on average among children with elevated urine protein and albumin compared to those with urine protein and albumin in a normal range. In children who had only high urine protein but normal urine albumin, the GFR was lower by 9 ml per minute compared to those who had neither proteinuria nor albuminuria. Those with elevated albumin creatinine but normal protein creatinine ratios showed no difference in eGFR from those with neither albuminuria nor proteinuria. We quantified the association of proteinuria and albuminuria on progression of kidney disease, defined as either a decrease in eGFR by at least 50% or needing dialysis or undergoing kidney transplant. The relative times to the endpoint were nearly identical when comparing the middle and highest categories of proteinuria and albuminuria to their normal categories using clinically meaningful cutoff values. We also determined whether non-albumin protein, the difference between total urine protein and albumin, was useful to predict progression of kidney disease. This measure was well correlated with proteinuria and had the same ability to predict progression of kidney disease as proteinuria and albuminuria. Thus, our study shows that in children with chronic kidney disease in the absence of diabetes, the utility of an initial proteinuria, albuminuria, or non-albumin proteinuria to predict progression of kidney disease is similar. Based on these findings, we recommend monitoring only urine protein creatinine ratios in children with chronic kidney disease to predict disease progression.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.